Thanks, Bill. I'd like to welcome you all here. Those of you who have travelled from around the corner, and those of you who have travelled from interstate, from Adelaide, principally because you have an interest in our community. The future of the Keith District Hospital as the key health service provider to our region, both for our district's constituents and those that are passing through, is in crisis. The hospital belongs to the community, and it is necessary for you, the community, to decide what its future may be. To assist you in the process of making your decision, tonight's meeting will provide an outline of the processes that have occurred in the period over the past 5 months since the state government announced a funding cut to our region's community hospital. On behalf of the board, I will focus on the key activities that have taken place in this time and how they have shaped our current position. You obviously will all have questions and viewpoints regarding this critical issue affecting our community. I ask that you can consider the information you are provided and take the opportunity to talk with each other and the board between now and the next meeting on March 16th. Each of you will respond to the information in a different way, and I ask you be constructive in your feedback and confident in the notion that any viewpoint is as important as another. To begin with, I want to acknowledge all members of the hospital board who, in the past 5 months, have met on numerous occasions with up to 4 meetings per week at times. The level of interaction has been intense. The board has been challenged with dealing with the funding crisis as well as to manage the needs of normal board requirements. It has also continued to plan and initiate actions to foster the business of the hospital to meet the community's needs. It is a credit to the board members to give of their work and family time to focus on this critical need for our community. It has been and still is a highly stressful period that tests the content of each other's character. I wish the board well in the forthcoming period, as the decisions and actions that lay ahead will quite possibly be more challenging than those that have already passed. I want to publicly acknowledge the hospital CEO and Director of Nursing Heidi Clow, as well as the hospital finance manager John Howe. As well as manage the daily affairs of the hospital, both of them have put in countless hours beyond their normal workplace duties to assist the board during this period. The board recognises the high quality of their inputs and their characters, and without their skills and knowledge, the board's role would be far more challenging. Both of these people are integral to the success of the hospital. Of course, a significant part of a hospital's effective operation is the staff. I would like to acknowledge all the staff of the hospital for their patience and respect to the board through this turbulent period. It cannot be easy on anyone's state of mind to have your workplace's future in jeopardy, and yet all your work outputs have remained to the highest level, with noted advances beyond the current high standard in some areas of operation. To the best of its abilities, the board has kept the staff of the hospital up to date through this process. 3 staff meetings have been conducted in a question and answer format. A meeting of the aged care residents' families took place on the 15th of February. I want to acknowledge the families of our hospital's aged care residents for their understanding and support through this period. In particular, I want to acknowledge you, that is, the community. Through this recent period, the community's actions and outputs, whether through or outside the action group, have been crucial to keeping the profile of our hospital's issue at the forefront of the public conversation and media interest. Since its origin, the hospital has placed a large reliance on the generosity of the community, and right at this point of time, this reliance has never been greater, as the current future of the hospital is placed in your hands. Following this presentation, James Ryan will report on the activities of the Hospital Action Group since its inception. Given that the Keith and District Hospital is your hospital, that is, it's a community hospital owned by you, all as ratepayers of the Tatiara and Coorong District Councils, the Board is obliged to inform you of the processes and outcomes that have taken place in the past months. I'll outline these processes now, and following this, Board member and Chair of the Hospital's Finance Committee, Sarah Martin, will outline the hospital's financial situation and what options exist for the hospital and how you may consider being involved. The hospital was first made aware of the state government's proposed funding cut on the 18th of September last year in an article in the Saturday Advertiser. Given the knowledge the state government had about our hospital's financial position prior to this time, the government bore witness to their lack of respect to our hospital, its role for our community and the community itself. Following on from the public meeting in October and the rally at Parliament House at the end of October, the state government instituted the Country Health SA process. This process is still ongoing and involves the state government's Country Health Department working with the Keith Hospital to assist in a future with reduced state government funding. On the 13th of December 2010, the Board, Hospital CEO and Finance Manager met with the Director of Health and the Director of Country Health SA. This meeting permitted the first formal discussion between the hospital and the government since the announcement of the funding 3 months earlier. Since the announcement of the funding cuts 3 months earlier. The Board provided a statement of position relating to the impact of the funding cuts to the hospital, and it also highlighted that the Keith Hospital was able to provide the same services as a similar rural South Australian hospital for a third of the cost to the state government. The Board also highlighted the importance of a health service such as Keith to both its community and the travelling public of Australia. At this meeting, the Director of Health stated that he did not care if the hospital closed, and that if it did, they would replace it with a paramedic station. Anecdotally, such a service is estimated to cost upwards of $800,000 per year, over twice what the state government is withdrawing from our hospital. Following this meeting, a Country Health SA working party undertook a research exercise into all aspects of the hospital, primarily finances, staffing, aged care and acute care organisation and activity. The hospital management team contributed to these meetings and the conveyance of all requested information as well as additional information. On the 24th of January 2011, the Board met with the Director of Country Health SA and the Country Health SA Regional Finance Director. The meeting was held in Keith and was prior to release of the Working Party report. At this meeting, the Board again highlighted the impact of funding cuts and what they were having on the hospital's immediate bottom line, particularly in the aged care aspect of the hospital's business. The Board highlighted that the hospital's financial projections were pointing at a negative cash position by the end of April. At this meeting, Country Health flagged the suggestion that a business plan be conducted to identify how the hospital could structure its business to be viable into the future after the funding cuts were implemented. The Country Health SA Working Party report was provided to the hospital on 3rd of February 2011. The report highlighted suggested changes to the business in relation to structure and operations. It also highlighted the possibility that the hospital's aged care facility should be able to increase its Commonwealth funding base. The Board had previously implemented aspects of the report's suggestions to operations and structure. The Board assessment of the report is that there are aspects that can be implemented, or with some modification can be implemented. But there is disagreement with the dollar value of savings suggested for such changes. The report has a high reliance of success of the best case scenario to assist the hospital with a viable future. From a commercial business perspective, basing a business's viability on a best case scenario budget has its obvious risks. The Board is currently assessing the suggestions for increasing income through the ACFI aged care process. We expect there will be increased revenue through alterations to access to Commonwealth funding. It is at this stage unclear as to the total net value of possible funding increases. Prior to the announcement of the funding cuts and up until now, the Board has needed to evaluate and act on the requirements for the operation of the new Keith and District Medical Centre. Attracting additional doctors to work in the practice has been the highest priority. Dr. Dean has settled in well and has developed good support from the communities of Tintinara, Pathway and Keith where he consults. We have recently gained the services of Dr. Stewart and are currently in negotiations with another doctor currently based in Adelaide. Attracting and retention of doctors to our community is a key to the success of the medical centre and the hospital. It is a highly competitive process to gain the services of a GP in a rural area, and the Board is undertaking all it can in what are difficult circumstances. In addition, the Board is assessing the operation of the new medical centre and is using the resources of the Rural Doctors Workforce Agency to assess its viability. The Board has researched options for the aged care service and the existing residents that may be suitable fits for the hospital, should the hospital remain open or not. There is a fundamental need for aged care services in the Keith area, and the Board is confident of such a service maintaining itself in the region. At present, the Board are in informal discussions with third parties about the future of aged care in our region. As always, there are ongoing modifications to the operational aspects of the hospital, but a number of changes have been forced due to the hospital's financial crisis. As always, the Board has been acutely monitoring the hospital's financial position to enable to most appropriately make decisions for its future. Communication with Senator Nick Xenophon commenced in October last year, which led to the Senator visiting the hospital on the 27th of January. Senator Xenophon is passionate about the issue of the state government's funding cut to the Keith Hospital. Through all the demands made on his time due to commitments of his public office, he still manages to keep up to date on the hospital's progress, as well as undertaking all he can to assist in solving our crisis at the political level. He is a genuine politician and one whom is trustworthy. On February 8th, both myself and fellow board member Richard Vickery travelled to Canberra to attend meetings with Senator Xenophon and the Western Australian Independent Tony Crook, New South Wales Independent Rob Oakeshott, and Tony Windsor, the Federal Minister for Ageing, Minister Mark Butler, the Shadow Health Minister Peter Dutton, along with Patrick Secker and Chris Pine, and the Rural and Regional Health Advisor to Minister Roxon. The purpose of the visit to Parliament House was to inform various politicians of all persuasions of the Keith Hospital's predicament and how we have been frustrated by the state government's lack of respect for our hospital, our community and our region. We were informed last week that the Federal Liberal opposition had developed a notice of motion to put to the House of Assembly. This was put to the House last night and will be debated at the end of March. The motion seeks to take funds from the National Healthcare Specific Purpose Payment in the next financial year and make direct payments to Keith, Moota and Ardrossan hospitals. The response to the notice of motion in the lower house last night would suggest that even if the motion was supported in the lower house, the government will not act on it. Through all the processes of meetings, on and off the record, the letter writing, emailing and the media outputs, the Board has been able to raise the profile of Keith Hospital's situation across the state and nation. The Board acknowledges the letters of support and the donations to assist its survival from both the community and the general public across the state. However, at this stage, the hospital's financial security and immediate viability is extremely dire. The Keith and District Hospital is an incorporated entity, and consequently the Board is bound, like any other board, by the rules of corporate governance. Such rules are found within our Constitution, within the Incorporations Act and Corporations Act. Such rules apply to how the Board utilises the funding of the organisation, as the money under its control is that of the shareholders, which in our case is the community. The hospital holds money in bonds that belong to some of its aged care residents. Such bonds are held by aged care providers, such as the Keith Hospital, to aid in aged care provision. When a resident receiving residential care, who has a bond arrangement with the hospital, either passes on or moves to another aged care residence, the provider is required to refund the bond balance no later than 14 days. From this bond amount, the hospital retains an amount for its services, which is referred to as the retention amount. The Aged Care Act governs rules of collecting and managing aged care accommodation bonds. Under the rules, accommodation bonds must be used for the purposes related to the provision of aged care and which comply with the prudential standards governing bond use. Income derived from the investment of bonds, that is, the retention amount, has to be used for specific aspects relating to aged health care outlined in the Act. The rules do not explicitly preclude the use of accommodation bonds or retention amounts for operating expenses, so long as the use is related to the provision of residential aged care and that the provider is always able to meet its funding obligations. This area of the accommodation bond policy is a very grey area and is currently under review due to the federal government's decision to strengthen the prudential regulation of the bonds. One aspect of the Aged Care Act is set out in the user rights principles. This is the liquidity standard that states that an approved provider must maintain sufficient liquidity to ensure that they can refund the bond balance as it falls due. In other words, the business must have enough access to cash in 14 days to refund the bond less the retention amount. Currently, the federal government is experiencing poor corporate governance management of accommodation bonds, which has led to compliance failures and financial difficulties with some providers. This has led to the use of the Accommodation Bond Guarantee Scheme, which is a mechanism that sees the federal government pay out the bond refund when the provider has spent it and cannot get access to the necessary cash funds. This results in significant penalties to the aged care provider, and the federal government currently has a consultation paper regarding the use of accommodation bonds released for public comment. Should the proposed measures of the consultation paper become an amendment to the Aged Care Act, criminal penalties could apply to providers who knowingly fail to meet their responsibilities of the use of bonds and retention amounts. Now, the purpose of highlighting this issue to you is not to give you an education of the Aged Care Act requirements, but highlighting this issue to you is that management of accommodation bonds and retention amounts requires appropriate governance practices. Given the current financial crisis the hospital is facing, it was recommended by the State Government's Health Department for the Keith Hospital to use the accommodation bonds and retention amounts, which amount to over $470,000 as operating capital to assist in trading ourselves out of the current problems. The Board has questioned this advice, and given the rules I have outlined earlier and the necessary due diligence processes we must adhere to, we find this advice highly questionable and inappropriate. If in the event the hospital were to become insolvent and the accommodation bonds and retention amounts had been expended, it would create significant problems to the families concerned, as well as significant penalties with possible legal implications to the Board. With a basic risk-benefit analysis of following such advice, the risks, given the hospital's immediate status, far outweigh the benefits. The State Government Health Department has also offered advice to the effect that the Board use the saved staff provisions, such as long service leave entitlements, as operating capital, while it deals with the readjustment of the hospital's operations due to the State Government funding cut. Once again, the Board finds this advice conflicts with all the rules of governance of an organisation, particularly in a financial dilemma such as ours. At the end of the day, the provisions are the staff's hard-earned capital, and the Board cannot and will not knowingly break any law or social moral with respect to other people's money. The Board finds it difficult to understand or comprehend that the State Government would suggest that breaching a federal or state act or dismissing basic moral standards was a satisfactory means of dealing with a reduction in State Government funding support. Our hospital is on the brink of insolvency, a fact the State Government is well aware of, and using other people's money that we have in trust with the risk of never recouping it for the families involved is not an option. The Board is currently in discussion with Country Health SA regarding Country Health SA funding the development of a business plan for the hospital, which they believe will give us suitable direction for a future with reduced State Government funding, and be a commercial business plan which would be supported by a commercial financial institution. The Board's position represented to the State Government has, at all times, called for reassessment of the proposed funding cut and a reinstatement of funding to support the existence of the Keith and District Hospital in the appropriate manner. The Board has stated plainly that the manner in which the Government has treated the Keith Hospital has been inappropriate and far from what any community or taxpayer should have to tolerate. This fact has been acknowledged and agreed to by the Government representatives. The State Government has refused to enter into discussions relating to reinstatement of funding or even to financially support the hospital by means of a grant to readjust to the change in the funding level provided. Minister Hill has refused to meet the Board to discuss specifically the Keith Hospital issue since the funding cut was announced. The Board has requested the meeting on a number of occasions via various means. As a community, you have supported your hospital since it began in 1954. It is in your nature to support it as you understand its role in the region. You are now faced with having to decide if you will do so even more than in the past, so that the hospital has a chance of surviving into the future. If the hospital is to survive, each and every one in the community will need, to the best of their abilities and their own personal requirements, to support the hospital by using all its services when you have a need. This is one of the best ways the hospital and the medical centre can remain viable and develop the suite of services that you all need for your own and your family's health needs. For the hospital to determine its fate, it needs financial support to create the time to put in place its best efforts of establishing a viable operational model with as long a term future as possible and with minimalist support from the State Government. I wish you well in your deliberations. Thank you.